Welcome to a Global Healthcare Policy and Management Forum. As you know, I made this forum in year 2015. Since then, many world-renowned scholars have joined in this forum to share knowledges and insight. As you know, South Korea made a remarkable success in developing medical tourism industry during the last 10 years. In year 2009, we had only 60,000 foreign patients, only 60,000. In year 2019, last year, we had 495,000 foreign patients. I'd like to express my sincere gratitude to our colleagues for helping us to make this miracle. This year, the global world is suffering the COVID-19 pandemic. This pandemic made a devastating effect on the global medical tourism market. It looks like a perfect storm. Hence, we need to get together for finding the solution for the current crisis. I'd like to once again express my sincere gratitude to the speakers for joining us to share their insights. In the first session, we'll talk about the COVID-19 and the medical tourism market. There will be 4 speakers on 3 topics. Now, I'd like to introduce Josef Woodman, the CEO of Patients Beyond Borders from US.
Welcome, everyone, to the new normal. I don't think any of us saw this coming last year when many of us met at the conference in Incheon in October. And I'm glad to be meeting all of you all, virtually, but would much rather meet in person. And one day in the not too distant future, I know that that will happen. Thanks so much to Nam and his team for having the fortitude and vision to bring this forth virtually so we can, as they say in Hollywood, the show must go on. So this is a good, I think a very good thing. I'm super happy to have Andy and Trish here because we've shared a lot in the past, met all over the world, and they have so much to contribute, especially from the U.S. perspective, dealing with some of the very top clinics, not only in the U.S. but around the world. So Nam has asked me to talk for 15 minutes about how the world can now adapt to this constantly changing environment and how the pandemic has affected medical tourism based on some of the data that he's been sharing and will share with you, and some of my experiences around the world with various countries struggling to adapt, to open up, to preserve patient safety, and to try to get some kind of a life and an economy back. So a very brief history for those who don't know Patients Beyond Borders. We're mostly a publisher, and we have for many years been a leading industry source of information about medical tourism for various stakeholders, for patients, for hospitals and clinics around the world. We published a number of editions with over 150,000 copies in print. I'm proud to say that I've made 7 medical tourism visits to South Korea and 2 to Incheon, thanks to Nam. And we just before the pandemic hit, we published in late January the 4th edition, which was launched, which included an updated section on Korea. So we've collaborated with ministries of health, tourism, and economic development around the world, including countries like Korea. And we've worked with some of the top hospitals and academic medical centers in the world as well. And I'm proud to say we've influenced hundreds of thousands of patient visits through working with third parties, and we've contributed something on the order of $500 million in cross-border wealth creation, which we hope has helped to raise the bar and the infrastructure in countries around the world, their healthcare. But enough about us. First, I'd like to just delve into briefly a very brief overview of medical tourism around the world pre-COVID, during, and what we might expect to see in the future. So just a very brief recap. We were really clipping along in the medical tourism business. I've been around for 15 years at this. Helped to really establish some of the parameters around medical tourism. And I will tell you that it's been a tough ride. The growth rate has been there, but unlike adventure tourism and wellness tourism, river tourism, voluntourism, medical tourism it's been tough to really build a universally accepted stronghold and to have it get worked into the collective consciousness. Just the last year, we saw a real spike, a lot of media attention. Large media outlets were just referring to medical tourism as if it were a thing and it's something they didn't have to explain. And that was going along really well. We were seeing steadily improving international patient safety standards. We were seeing countries that were actually source countries then turning into destination countries. We were seeing different types of specialties, including wellness travel. And importantly, we were also seeing a whole new breed of patients beginning to embrace medical tourism, not just old people like me, but millennials who were beginning to have to make decisions for their aging parents, who really didn't trust the healthcare system in their own country as far as they could throw it, who were much more open to travel and much more open to search on the internet. And we were seeing a lot of these trends began to come together in a very encouraging way. And then the pandemic hit. And of course, that has changed so many lives in so many ways, so many businesses, and not the least of it, medical tourism. When you combine healthcare with travel, you know you're going to be in for a shock. So March and April, most of the world experienced an 80 to 100% drop in cross-border medical travel. And much of the world is still pretty much shut down to international travel. We did see in June and September kind of a cautious resurgence with some of the very few countries that were beginning to open up, most notably Mexico, and we'll get to that in a few minutes with a little bit of a mini case study. Even today, as we know, very few international borders are open, and they are open only conditionally. A quarantine and ancillary expenses are just wiping out any cost savings that people travel for, unless you're getting something extremely high cost. And I think most important, we're still struggling with a large lack of patient and agent information that's reliable. The average person who is medical travel comparing and costs and vetting hospitals is largely an individual enterprise, even today. And so the average patient who's searching for affordable quality care doesn't really know where to go to get information on travel restrictions, airline schedules, quarantine policies and procedures, and facilities that are COVID ready. And I really think it's up to one single hospital or hospital network can't make that happen. I think it has to happen at the ministerial level, at the federal level or local level, state, cities, metropolitan areas, so that patients can get reliable information on whether they can even travel or not. We have data that shows that there's still a lot of interest in medical travel, and then they really don't know what to do with it. So through year end and early 2021, I think is anybody's guess. We're still struggling with just even getting to know what this virus is all about. People are talking about a harsh winter. We just really don't know until we've been through it a season or so. Vaccines, treatments, we know are going to have side effects, and testing is unreliable at best, whether it's symptom testing or serologic testing. So I think from a on-the-ground standpoint, I think we still have to, the show must go on, and I think we have to really behave in that manner. So many clinics and hospitals that I've talked to are frozen and they're reacting to the pandemic, but they're keeping their eyes off the prize, which is continuing to try and make the best of what they have. If you have a weak international patient services center pre-pandemic, you're probably going to emerge with a weaker one post-pandemic. So what are the kinds of things that we can look at? And these are just my best guesses based on the information at hand and some of the data that Nam will get into next. What we've seen around the world is that the drive-to patient, there's been a lot of talk about travel bubbles. And when you think about it, an automobile is like a little mini travel bubble. People are really having a hard time with airplanes, trains, and other forms of mass transportation. So I think targeting the domestic drive-to patient is one of the first things that one can do to begin to wake things up in terms of medical travel. Specialty treatments, what we've seen when the Mexico border opened up was that the complex care, whether it was dental care or other kinds of care, people were drifting over the past 6 and 7 months into medical emergencies. And they had to get care. And as I mentioned to a New York Times reporter a few days ago, one dental implant is equal to 3 stimulus checks in the United States of $1,200 a piece. So some of these people just flat can't afford it. They're scared to death of being out of a job, or they're already out of a job. So I think you look at the patients that are really looking for the complex treatment or have drifted into the need for complex or emergency treatment. The Zoom effect, I've seen some talk about that, and we see that it's real. There's a lot of people traveling to Mexico for cosmetic care. And what I mean by the Zoom effect is people are seeing each other on Zoom close up, sometimes uncomfortably close up, and they're going, oh my God, I look terrible. What am I gonna do? And it's creating a spike in cosmetic surgery and non-invasive cosmetic treatments. Korea has a reputation. I know a lot of the hospitals don't like to promote it, but I think it's something that is important. Bumograd, for example, for the longest time didn't promote cosmetic and dental treatments, but they began to see it as a gateway. So people would come in for a treatment that they didn't think was particularly invasive, or they didn't even consider it surgery, and they would go, wow, what's this? And they'd have a Botox treatment, or they'd get a filling, or they'd have a root canal. And then they'd look around and see this gorgeous hospital, and it was like a gateway effect. You want to experiment with telehealth, and there's been a lot of talk about telehealth. We're seeing that doctor teleconsultations with the patient, they're having a hard time with that. I may be wrong, it may be I've got false data, but the data that we promoted teleconferencing and video conferencing really heavily, and doctors just don't like it. There's language barriers, there's time zone barriers. They don't feel like it's worth their time. They don't feel like they're being compensated adequately. But there are different ways to communicate with the patients via video, and all kinds of different ways to use telehealth, and you should really try to adapt to the different ways to use it. Obviously, expect slow recovery to profitability and court new stakeholders. You're going to see hospitals, international patient centers disappearing or becoming weak. Others will become stronger. They will adapt. So you want to look for the most adaptable stakeholders and really take a look at what they're doing and cozy up with them. I know that I'm running out of time, so I'll just briefly, we have been dealing a lot in the United States with Mexico. They initially experienced an 80 to 90% drop in foreign patients, and a lot of the fly-to areas was almost 100% drop. There just weren't any patients at all. But the border towns, once Mexico opened back up, many of the clinics have closed for good. The larger centers are poised to actually profit, and they'll probably come out better, unfortunately, for a lot of the smaller clinics, but good for them. The main thing that Mexico has had to deal with is all of the misinformation and disinformation around travel. Most people think that the borders are closed. And so anytime that happens, that's another thing about the information. If and when their borders open up and you get a green light, somehow the world needs to know about that. It's not going to find out by themselves. Again, we talked about the short haul drive-to markets. That's probably the only market that's available in the nearby states, but gradually they're starting to drift in from farther away. We're finding that there are fewer patients, but higher margins per patient because they're seeking complex care and they're not willing to take the risk and the expense to come in for a simple treatment. Thailand and Malaysia are good examples that they've been opening and closing. Malaysia tried to open and then it got slapped down. So there was a lot of publicity about it opening in Penang, and then the ministry shut it down. There was a lot of very open friction between the healthcare people and the economy people and the ministry people. And so in addition, Thailand and Malaysia are both requesting quarantines. And quarantines are something that, again, they may be really important from a healthcare and epidemiological standpoint, but they're a disaster for medical tourism because it takes a lot of time away and it takes a lot of money away from the cost savings. I'm not saying that it's a bad thing. I'm just saying that countries shouldn't really present it as a feature because the patients aren't really going for it. So Thailand and Malaysia are really a lot like the norm that you see in places like Hungary, Poland, Germany. Their borders are just very marginally open, sometimes open to just EU people, excluding the UK, including the UK. Who knows? It changes day by day. But those are the things that we've experienced. So looking beyond COVID, there's some things that we can do on the ground to reassure patients that are going to very gingerly begin to peak out and travel. Some patients are not risk averse at all. They may not care as much, but I think most patients, when it comes to jumping on a plane, considering transportation, considering staying in a hotel room, suddenly it gets very, very complicated and you're dealing with a huge matrix of exposure. So what the healthcare community can do, I think, is reassure patients with third-party certifications. Organizations like TIMOS, JCI, GHA, and Medical Departures have got varying certifications and accreditations specifically for COVID, so that a clinic can claim that it's COVID ready, which I think we're seeing that for many, many patients, that's becoming really important before they travel. I think COVID alerts, I see too many hospitals globally that don't have COVID alerts on their medical sites. They should be on all your sites and they should be updated weekly, including COVID ready messaging for all your patients. This is just an example of Bumrungrad again. They always manage to be in the leadership position and their rewards are obvious. This is a certificate of conformance from a group called GHA out of the United States that says that Bumrungrad has complied with a lot of the COVID ready criteria that was outlined by this organization. It's not perfect. Some of it's even a little like testing. Some of it is theater, but it does help to reassure the patient, and I think helps the staff and the infrastructure of a hospital become more and more aware of the kinds of criteria that you need. For Korea, again, like I said, COVID or no COVID, you need to continue to move forward. It's just great news to me that you've moved from 60,000 patients to almost 500,000 patients going forward. It's going to be even more important to be strong in terms of serving that international patient while we're trying to adapt to this. So I do believe that English is probably important because it's the international business language. When I was there in October, I still didn't see enough websites, staff, and signage in English. But I think you should also be looking at your key markets, China, Russia, and to a lesser extent, the United States and the EU. Most patients do desire a door-to-door experience where you're picked up at the airport. Incheon's welcome station at the airport is a wonderful idea. I think you can extend that to promote and assure the patient that they're going to have an insulated door-to-door experience. They're not going to have to hail an Uber. They know that they're going to be in a sanitized van getting to their hotel. They'll be picked up and taken to the hospital. And then when they're in the hospital, they're in a safe environment. And of course, an excellent patient experience is really important all the way up and down the line, not just the clinical experience, so that you can achieve rewarding word of mouth and reviews. We don't need to go over too much of this again, but insurers, for those who are looking to see insurers participate, they haven't been participating in the past, and they're certainly not going to be participating during the crisis. They've got way too much other stuff on their plate. Medical travelers, facilitators are still not focusing so much on Korea, and there are fewer and fewer in the US as the COVID pandemic has just shut everybody down. A lot of these are mom and pop shops that just simply aren't surviving. Out of that, I think you'll see a lot of online medical tourism agencies like Medical Departures, Dental Departures, What Clinic, IMTJ, Treatment Abroad, become even stronger as the world gets more and more accustomed to searching online for affordable options. This is just an example of a way that one organization, this happens to be Medical Departures, has over-communicated with their patients. And this is a red light, green light, yellow light. It's updated daily. That's on their website, free to the public, that tells people, patients seeking care, whether the border is open or not, and to what extent they might have a chance of becoming a successful medical traveler. Those kinds of things should be published by some agency of any country. It shouldn't really be up to an entrepreneurial third-party agent to do it. Countries themselves should be doing it in a way that is easily acceptable. Another example is, Korea is world acknowledged as one of the top 3 countries, if not the top country, in the excellent way that you handle the COVID crisis. I think there are creative ways to translate that to the patient who would be looking for a safe haven, especially for complex healthcare. That this is a safe place that you can come. This isn't some third world country. This country handled the COVID crisis in a way that almost no other country did. And I think certainly a lot of Americans, UK folks who are just in these COVID-soaked environments still would benefit by that. But it's a matter of getting the messaging out to the public, and not just within a small media niche. Finally, just some key differentiators for Incheon. I just wanted to pound home the fact that within Korea, there's a lot of competition for Incheon. There's Seoul, Daegu, there's Busan, and again, patients want to know that they can get in and out quickly. So geography is very important. I know I've had some really harrowing rides from Incheon into Seoul that took 45 minutes, sometimes an hour and a half. Sometimes it took 35 minutes just to get to my destination once I was in Seoul. So I don't think we should underplay geography as a really important part of the messaging for Incheon. And cost and convenience are also really important. A lot of medical travelers are very cost sensitive. Once they get to the airport, why not be in a town that's very close to the airport, that's right next to the airport? Convenience is so important for some of the patients visiting hospitals in Turkey and Germany and Singapore, where they've set up right next to the airport, and you guys have that built in. So those are 2 areas, in addition to obviously the quality of care and the patient safety benchmarks that many of the Incheon hospitals are famous for. Just very quickly, and to conclude, you want to leverage and expand existing markets that Kinan will point out going forward. They shift, but I think you're seeing a lot of solid response from patients in Russia, China, and North America. Definitely improve English, because that's the universal business language. Most people can at least get it over the net, and I think it is important to continue to do that. And I'm not talking just from a purely ethnocentric standpoint. Definitely focus on domestic and short haul patients. Again, consider dentistry and cosmetic surgery and non-invasive treatments as gateway treatments to more complex care. And definitely begin to be on the lookout and reestablish relationships with a lot of these new normal facilitators and third-party agents, because the whole world is changing now, and the people that existed before aren't going to be around going forward. And there are people that are going to come up from nowhere, and they are going to do what we all should be doing as we move forward. And I think the folks that adapt are the folks that are going to survive and thrive. So if I have one mission, it's stay on point and just continue to adapt through these crazy times of ours. And I know that we'll all survive, prosper, and meet again, which I'm very eager to do. So thank you. And that's it.
Hi, this is Nam Jin from Yonsei University in South Korea. Today, I want to talk about COVID-19 pandemic and medical tourism in Incheon. In my presentation, I'd like to deal with three topics. The first topic is the medical tourism trend in Incheon. The second topic is COVID-19 challenges for medical tourism market. The third topic is market forecast. Let me first talk about the medical tourism trend in Incheon for last 10 years. As you can see from this chart, we have seen the steady increase of medical tourists during the last 10 years. In year 2009, there were 4,400 medical tourists in Incheon. In year 2019, the number has increased to 24,864. In this chart, you can see the change of ranking. Seoul has been always ranked number 1, followed by Gyeonggi-do, which is the adjacent province. And in this chart, you can see the change of ranking. Incheon has competed with Daegu to take the 3rd position. This table shows percentage of medical tourists by nationality. China has taken the 1st position for last 10 years. In year 2018, Russia was ranked 2nd, followed by US, Kazakhstan, Japan. This table shows the preferred services across the years. Internal medicine has been the most preferred services. Health checkup was ranked 2nd, followed by dermatology, orthopedics. Now let me talk about the COVID-19 challenges for medical tourism market. I want to explain the impact of COVID-19 on the stakeholders in medical tourism market. Let me first talk about the impact of COVID-19 on medical tourists. Since February, we have seen the reduction of medical travel demand. Because of border shutdown, medical tourists have been forced to cancel their travel plans, especially the high-risk patients like elderly patients, patients with underlying health conditions would avoid going abroad for the time being. The medical tourism facilitators hit hard. Significant decrease in foreign patients has led to a dramatic decrease in revenue. Most of them have laid off employees. Some medical tourism facilitators even went out of business. There were nearly 1,500 medical tourism facilitators only this year in South Korea. This number has decreased to 1,216 as of September. Nearly 20% of medical tourism facilitators went out of business. The key issue is how to survive the perfect storm of COVID-19. The healthcare providers also hit hard. Significant decrease in domestic and foreign patients, cancellation of clinical services, and increase of expenditures for IPC, which means infection prevention and control, have led to a dramatic decrease in revenue. There is a high probability of a hospital closure. Some healthcare providers heavily dependent on foreign patients struggled or even closed the international operations. International clinics are laying off translators and medical tourism coordinators. They are exposed to the risk of losing international business assets like networks and human resources. And nearly 2,000 healthcare providers were registered to treat the medical tourists in January. This number has decreased to 1,580 in September. nearly 20% of registered medical institutions decide to cancel the registration in order to reduce the financial burden of paying the liability insurance fee. The key issue is also how to survive the perfect storm of COVID-19. Now I'd like to make a market forecast. Let me first talk about the short-term forecast. Medical tourism market is expected to shrink for the next 1 or 2 years. We are expecting the decrease of medical tourists in the following cases like elderly patients, patients with a certain underlying conditions, or patients for elective procedures. However, there will be increasing outbound demand from the countries with the dysfunctional healthcare system. There will be a growth of domestic medical tourism market. After COVID-19 pandemic, domestic medical tourism will precede international medical tourism. The rebound of successful medical tourism market would be stronger in the countries with successfully dealt with the COVID-19 pandemic or were less overloaded with cases. We are expecting the rebound of wellness tourism market. After COVID-19 pandemic, there will be a significant shift towards wellness services because of the following reasons. There will be more concern for marginal immune response to COVID-19. Many people have suffered COVID-19 related stress. There will be increasing interest in well-being. In the global market, in the global medical tourism market, we'll see the geographic segmentation of medical tourism market. Because people would avoid the long distance travel, short distance travel market will be developed. We will see the emergence of travel bubble. This table shows the percentage of medical tourists by nationality. Among the top 8 countries, Mongolia, Vietnam, Thailand, showed lower number of COVID-19 cases and lower mortality rate. Hence, we are expecting to make the first travel bubble with these countries. This table shows the preferred services by nationality of medical tourists. Patients from Mongolia, Vietnam, and Thailand preferred internal medicine, cosmetic surgery, health checkup, dermatology. This table shows the market share of countries of first bubble. Patients from Mongolia, Vietnam, Thailand occupies 8% of internal medicine market. In the case of cosmetic surgery, they occupies 13%. Now, so we need to make a plan for gradual lockdown easing. Now, let us talk about the long-term forecast. I'm expecting the improvement of destination brand competitiveness of Asian countries. There will be a chance to gain the strong presence in Arab and CIS market. Digital connectedness by using telehealth will become the essential service component for foreign patients. Countries with well-developed ICT infrastructure and technical readiness will gain competitive advantage in global medical tourism market. Some medical tourism facilitators, which are based on the online platform business model, would gain competitive advantage over others after COVID-19 pandemic. Thank you for listening. Thank you. The third speaker are Tricia and Andy from Russia University. And they have visited South Korea several times, and they have quite well known in South Korea. And they have studied the global healthcare for many years. And so that's the reason why I invite them for this conference. And please give us your insight. Thank you.
Thank you, Professor Jin in the Incheon Metropolitan City for inviting us to speak at this conference. Dr. Andy Garman and I are delighted to join you today. We'll talk briefly from the United States perspective about how health services have changed with the onset of the COVID pandemic and what the future might look like. Just briefly, we'll talk a bit about what the inbound travel looked like for the United States before the COVID pandemic hit the US in March. Talk a bit about how it might look as recovery, what recovery might look like as we go forward, and the future of medical travel more generally. Let me talk just briefly now about the history of medical travel in the US prior to COVID. Here you can see a snapshot of the percentage of pediatric and adult patients and patient volumes for a subset of the US Cooperative for International Patient Programs. This is based on 34 healthcare systems reporting. And you can see it was approximately $2 billion in gross revenue in the 2017-2018 timeline. Somewhere about a quarter of the patients were pediatric and 75% were adult. Totaled approximately 57,000 unique patients across 50 organizations. If I show you a brief snapshot of the top specialties coming into the United States, you can see here for both adults and pediatric patients, it's cardiology, cancer, and the neurosciences top the list. On the bottom panel here, you can see the country of origin for both adult and pediatric patients. Across the board for pediatric patients, they're principally coming from the United Arab Emirates, Kuwait, Saudi Arabia, and Mexico. You see similar patterns on the adult side historically, although not quite as consistent in rank for unique inpatient and outpatient visits. 80% of all new and return patient referrals are coming from one of these four sources. Self-referral has been historically the top source for patients coming into the US, followed by payer referral, word of mouth, and a referral from non-US physicians. Let me now turn things over to Andy to talk a bit about how we look at drivers for inbound medical travel that will help to set the stage for looking towards the future.
Tricia, thank you very much, and thank you, Professor Jin, for the invitation. I wish I could be in Korea in person. It's my favorite country to visit, and Joe Woodman, one of my favorite co-presenters. I want to say just a couple of quick comments by way of context on some of the work that Tricia and I collaborate on. And it relates back to one of Joe's earlier comments about understanding what the future holds. And it's anybody's guess at some level, but on the other hand, professionally, we're required to guess. And so the guess that we come up with, the estimates, in other words, are based on several sources of information. I think Joe did a really nice job of outlining what you see in this diagram as just a different perspective on the patient decision-making process. I wanted to provide this as a part of our presentation, and it underscores some of the points in terms of, it's not just a matter of providing excellent care, but it's also that sense of safety, and it's that weighing of costs and benefits in terms of other options that are available, including what might be available either by staying home or deciding not to pursue treatment at this time. Tricia, if you could move forward to the next slide. What we'll do is zoom way out from the individual patient and just provide some perspective from a longitudinal standpoint. And there are several sources of information I wanted to share with you today. Briefly again, on the left-hand side, the diagram that you see there is from the United States Substance Abuse and Mental Health Services Association, the Disaster Recovery Technical Center. And essentially what we're dealing with in the United States is a post-traumatic recovery. We're working with hospitals who have seen clinicians facing the need to provide care for their fellow clinicians. in circumstances that they were not trained fully for. There were periods in some parts of the United States with shortages of personal protective equipment. Some of the good that has come out of all of this is a lot of need for innovation, a lot of need for experimentation. But we are also anticipating in the months to come that period to the right-hand side of the diagram there, which is, we saw this honeymoon period where people were living on the adrenaline of doing what they're calling called for, but there is this disillusionment period, a lot of struggle in terms of moral injury and other challenges, and we're going to be entering what we believe will be a reconstruction period of 6 months to perhaps several years. The middle two graphs, this is an even further out perspective longitudinally. What you see on the top graph there is something called generational theory. And this comes from work that was originally published in 1991 by Strauss and Howe. The quick thing I want to make, or the quick point I want to make about this is this idea of intergenerational transmission of cultural perspectives. You have this pendulum swing back and forth in terms of how a particular set of parents choose to raise their children, how the children choose to react to that parenting. And what it spells is this cyclical pattern of social perspectives and social upheaval. What's interesting about these two, this is a conceptual pattern, but the one on the bottom, this is Peter Turchin's work, and this was published in 2012 in the journal Nature, and several years earlier in the Journal of Cliodynamics. This is a quantitative perspective on cycles as it relates to social upheavals. So what you see in those blue spike graphs is cycles of violence. In the 1970s, and this is United States data, and in the 1920s, you saw some pretty significant spikes. This is important to us in the US because if you extrapolate forward, again, this was published in 2012, you'd hit a bullseye right around 2020 in terms of civil unrest and some significant social change. This was not on our radar in 2012, but the prediction was there for 2020. We're starting to see this now, and we anticipate that it's going to impact social policy, healthcare policy, and potentially the direction of the elections coming up here in the fall. So this also will impact how we think about some of these trends. But again, this is just background. Tricia is going to speak in terms of longitudinal patterns that she sees in her data. But to provide a little bit of context, the final pattern on the right-hand side comes out of the University of Minnesota. And this really comes straight out of epidemic and pandemic response patterns. You can see the scenario in the middle is this perspective of a two-pronged spike. In the United States, that secondary spike would be happening sometime in the late fall timeframe. We're anticipating a higher probability on this one than the one above and the one below, but part of that really relates to, as Joe was referencing, the nature of the vaccinations, the nature of the progression of COVID-19 and the ways that it mutates and the like. So just by way of background, I'll turn things now back over to Tricia to speak to the travel and inbound, outbound patterns. Thank you.
Thanks, Andy. That set the stage very nicely to talk about what we might see going forward in terms of recovery from the COVID pandemic for the United States. Let me just take a quick dive into what happened after 9/11, 2001, and the Great Recession to see if they can shed any light on what we might expect with the COVID recovery. First, just a quick glance. This is historical inbound passenger airfare expenditures. The blue line is a projection based on 2000 expenditures with annual inflation. So trying to standardize expenditures for inflation. You can see the green line is the actual. I've marked where things dove after 9/11 and recovered about by July 2004. Subsequently, you see this dip during the Great Recession that recovered relatively quickly. What you'll take note of is with the COVID pandemic, this wasn't just a little blip as we've experienced firsthand in terms of passenger expenditures, they fell to 3.7% of expenditures in July, a very dramatic decrease. If we dive into the post 9/11 tourism recovery, what you can see here is that the total inbound travel and tourism recovered at a much quicker rate than inbound medical travel overall. You can see even by 2008, when the Great Recession hit, we still hadn't recovered from 9/11. With the Great Recession, however, with this economic recession, travel recovered much more quickly. So you can see here, it didn't take that long after the Great Recession for travel to recover. What does this tell us for medical travel in COVID? In a nutshell, lots of words on this slide, but in a nutshell, the economic recession had a much shorter lived impact on air travel and medical travel overall. And travel generally paralleled the general economic recovery that we saw worldwide. This suggests that this consumer confidence in travel that we saw post 9/11 may have a much more significant impact as we move forward. We've worked on some projections based on these historical analogs and what we see as key milestones for the future of the future of travel and medical travel post-COVID. You can see our just very high level projections on the right, but more importantly, if we think about the demand and supply side factors that might influence inbound travel for the United States and for other countries. Part of it is related to how many people actually are traveling, looking at true inbound medical travel versus non-permanent residents seeking medical care in the US, some other definitional aspects in how different countries count international patients. Key, when will air travel resume? When will cruise travel resume? We forget about cruise travel, but a lot of international visitors receive medical care incidental related to their cruise travel. When is point of care COVID testing going to be available? And then ultimately, when's the vaccine going to be available? And when will it actually be in widespread use? On the supply side, there are some important factors to consider. Thinking about delays in diagnosis and pent-up demand, we saw a huge drop in anything that was even remotely elective in response to COVID to make sure that we could dedicate enough beds and clinicians to respond to COVID peaks when needed. That those delays and that pent-up demand is now slowly being observed. On the supply side is also this improved telehealth experience, expertise and infrastructure. On the negative side, we're seeing hospitals, as Nam and Joseph mentioned, hospital downsizing, fewer hospitals, hospitals laying off staff. These all have an impact directly on the ability of the hospital infrastructure to be able to serve international patients. Pent-up demand, the areas of care that we postponed with the onset of COVID are the exact areas of care that international patients travel for, elective surgeries, cancer treatment, and so on. So this pent-up demand is in some ways filling the short-term gaps that international patients may have served. But long-term, the question is, how long will it take to address this pent-up demand? As we think about the future, we look towards what we've learned in terms of telehealth, both the infrastructure and how we've become much more experts in delivering telehealth. Also looking at collaborations. What are we doing in terms of non-inbound patient collaborations to make sure that care is getting to areas of the world that need that care? Other strategies, I won't dive into the other strategies because I know that the next session will be focusing on this exact point. How do we use marketing? How do we ensure patient safety through accreditation and so forth in terms of preparing for medical travel as it starts to recover. And with that, thank you again, Professor Jin, for inviting us. And we're delighted for the talks today.
Thank you, Tricia and Andy, for your great presentation. Now let's have a discussion time. I have a short question to Josef. And Asian countries were quite effective in controlling the COVID-19. Hence, Asian countries had a chance to improve the reputation as the reliable medical tourism destination. However, this improved image would not guarantee the competitiveness in the long run. There are many contingency factors, as you and Tricia and Andy mentioned. In this respect, do you have any further recommendation for Incheon to consider in trying to improve their destination brand image?
Well, I think you make a really good point about how you get that message across, especially if you're looking at the US market, which is almost impenetrably xenophobic, if I might say. So it almost doesn't matter whether Korea or Singapore is a leader in controlling a pandemic. After all, we're the ones that refuse masks and PPE from Korea and from China when you offered them to us early in the cycle. So a lot of it's culturally driven, even more so it's politically driven. So unfortunately, I think it should be interwoven into the messaging and the dialogue. It should be integrated into the dialogue. It shouldn't be forgotten. But I don't know that you would spend a lot of resources, whether you're Incheon or Seoul or Korea in general, on actually promoting that. I think it should be an integral part of the message, but not your first foot forward. That's just my opinion.
Okay, thank you. I have a question to Tricia and Andy. In your presentation, you tried to derive the future implications from the past incidences like 9/11. The medical travel was slower to recover. However, that instance was confined to US. Under the current COVID-19 situation, most of the travel industry stakeholders across the world are severely damaged. So it might be much slower to recover. Most of the medical tourism facilitators, medical interpreters would have difficulty in sustaining their business. If the business base or infrastructure is gone, recovering the value chain in medical tourism market might take much longer time. What do you think? What is your opinion for recovery?
Yeah, I can start and then I'll turn it over to Andy. Kinam, I think that's a really good point in terms of the entire value chain being harmed, from the airlines to the hotels to the airports to the taxis, transportation, and so on. All healthcare and non-healthcare aspects of the value chain have been harmed. I'm not sure if it was you or Joseph that had mentioned consolidation, but I would anticipate that there is going to be a consolidation in all aspects of those value chain components that may ultimately result in some efficiency in how patients get here and in reaching them overall. So, and I do think also it will take longer. Obviously, 9/11 for the United States was a moment in time that had this long tail. We're not at that moment in time where we're even able to steady increase in terms of a recovery. So I wholeheartedly agree with you that it will be a much longer tail in terms of recovery.
I would agree with everything that Professor Johnson said. as I think about assets of Korea, and I can speak really only from the experience of the United States thinks very highly of Korea, culturally as well as technologically, and to keep that those relations and keep that reputation going as some reserve social capital, I think is important. What's the best way to do that? I'm not sure, but I do think that the recovery may not be very quick. I see a lot of promise in those relations in the long term.
Mm-hmm.
Andy, if I can intervene, if that's okay, I thoroughly agree with you, and that might be a really valuable way for Korea and Incheon to parlay and message the great job that the country did in dealing with the pandemic, not so much to the consumer world, but to various stakeholders around the world in huge, important healthcare centers where physician relationships and research relationships could very much be made advantageous by Korea's, very sudden escalation in your reputation as an extraordinary healthcare community. So that may be a way to, when you've got physician referral systems, research, it translates. I know there are many hospitals, like for example, Asan. They worked with us for some time, not so much to attract the patient, but to work the reputation as an organization that had an excellent healthcare infrastructure, stakeholder to stakeholder, not so much to the patient. So that could be a way in to promote your excellence and your excellent healthcare infrastructure, which would have a ripple down effect.
Okay.
If I could quickly add, just to extend a kindness and maybe slightly embarrass my friend Professor Jin. He's been in many venues, virtual venues in the United States, by invitation, speaking about the excellent job that Korea has done in managing COVID-19, and including several invitations that I extended. So he's doing a tremendous amount of ambassadorship all on his own.
Thank you very much. And thank you for attending this conference and sharing your great insight for Incheon. Thank you. I really appreciate. I hope to see you soon. Yeah, person to person. Yeah.
In
Okay,
real
great.
life.
Please stay healthy. Let's keep in touch. Thank
Stay
you.
healthy,
Thank
stay
you.
safe.
Thank
Thank you
you.
for the opportunity.
Thank you. Bye.
Bye-bye. Thank you.
Cheers.